Greetings. Welcome to my YouTube channel. This is Mushtaq Memon, Professor Emeritus from Washington State University. We are going to continue talking about integrative veterinary medicine, and we focus on different modalities of the IVM. So today we have a very interesting case, a cat with chronic diarrhea. And we did some acupuncture and got some very good results. So I just wanted to share with you to see what it was and how we did it. So this is Tanuki. She had a chronic diarrhea for quite a few months, in fact. She's 3.5 years old, female cat. And she was given quite a few different anthelmintics. And one is mentioned here, metronidazole. But then at the same time, there were quite a few laboratory tests done, including complete blood count, blood chemistry, urine analysis. They were all normal. By the way, the cat owner is the senior veterinary student at that time at Washington State University. And then the reason I'm saying, you will see that because she's a student, she's there, so they, I think, did quite a few different tests because she had access to the laboratories as well as the clinicians. So then they did some fecal flotation tests to try to look at any kind of parasite eggs, and that was negative. And then they changed the anthelmintic to fenbendazole for about 5 days, but did not see any difference. And then they did ultrasound. So with abdominal ultrasonography, our radiologist thought that there may be some mild pancreatitis. So they switched on food, but did not really help much at all. In fact, I had just returned from University of Florida from my sabbatical, so I had a little more knowledge about what was being done in addition to my own experience and background in acupuncture. So we decided to start acupuncture on her. So it was on July 15th. So I learned that GV1, which is governing vessel meridian, the channel of acupuncture, number one is a very important kind of point to balance the water as well as try to control diarrhea. So I did that along with a few other points that you can see here, governing vessel 20, bladder 20, 21 on both sides with the dry needle. This, the cat was not very cooperative. So as you can see here, I've got, 2 senior students and visiting a scholar from Taiwan with glasses. So we went ahead and repeated that acupuncture again after about a week or so. All those points was given because she was so hard to handle. So we decided to give aqua acupuncture. So it was vitamin B12 diluted and injected in acupoints of the same as I mentioned earlier. So, and then we added also stomach 25 on both sides, and then also conception vessel acupoint 12. I just want to make briefly some points here that we have 14 channels or meridians in these animals to try to work with, and 12 of them are on both sides of the animal, but there are 2 channels which are only one side, one a governing vessel which runs on the dorsal side of the animal, whereas the conception vessel is at the ventral side of the animal. So those 2 vessels have no sides, it's just one side, whereas the bladder, spleen, stomach, they're all on both sides of the animal. So then on, again, a week after that, so the client tell us, the owner, that, there seems to be less diarrhea than before. Well, we again repeated the acupuncture, aqua acupuncture, same way as we did a week before. I just want to make sure that all of us are familiar with where this GV1 is located. It is, as you can see here from the description of Dr. Shea's book, says this is the depression on dorsal midline between the anus and the ventral aspect of the tail. As you can see the arrow there with the GV1. So this is there, right, at the depression. You just can't miss it. And then the indications are quite a few. I just noted just a few here, which was pertinent to this case, was diarrhea, and it could be also useful for constipation. You know, you just wonder, what kind of medicine is that, or what kind of acupoint is that which can control diarrhea, as well as relieve constipation? And this is the beauty about Chinese medicine. This point is in a way that it balances the water. So balance is a key in Chinese medicine. So that point, and obviously with the help of other points, can balance the water in the animal. So other very important point, in fact, a very fundamental point, is the proper diagnosis. Just like in Western medicine, if we don't have the right diagnosis, regardless of how many antibiotics, how many injections you give, it's not going to do any good, right? So in the same way, in Chinese medicine, it is very important to have a pattern diagnosis. What type of pattern is that? So in that way, once you have that very clear, and then you can come up with different strategies, whether it's acupuncture, herbal therapy, whatever you are given. In this case, the pattern happened to be was defined as food stagnation. So that, based upon that pattern diagnosis, we went ahead and the clinical signs that you can see mentioned here could be soft or watery feces, and in some situation also anorexia. And as you can see, the acupoints or acupuncture which is recommended are these, which also we use: GV1, GV20, bladder 20, 21, stomach 25, and also CV12. I don't want to spend too much time here on these points, but just to give you for your own information, that GV1 is considered more like a local point, and that is the controlling the diarrhea and balancing the body fluids, whereas the other points which we did, bladder 20, 21, they are more like a back shoe point is called. And I don't want to really get you too confused about it, but this again comes with more you do, more you learn, more you understand what it is. So spleen in Chinese medicine is not really only the organ of a spleen. It's almost like a digestive system. So it's just to balance that thing. So I just wanted to make those few points so that you know what we are talking about. So here we go. The owner, our student, which is a few years ago, now she is a very successful doctor out in the field. So Betsy writes to me, very interesting email. I thought, you may enjoy reading her email rather than I try to make a PowerPoint slide. She said, Hi, Dr. Memon. You are going to die laughing when you open up the picture attachment. I was cooking dinner tonight and saw Tanuki assumes the crouch as I rushed over in time to see if she was going to pass normal feces. She did. I was so excited to witness at first hand that I nearly knocked her out from the litter box to take a picture to send you as evidence-based medicine. I have to say that I never thought I would send anyone a picture of cat shit, and especially be this excited about it. But to see the proof in front of my eyes without any doubt is absolutely thrilling. I'm laughing pretty hard now, knowing that you will probably be just as excited to get a picture of a normal cat shit as I was to take it. Ha ha ha. So Betsy had taken our integrative veterinary medicine course when she was a second-year student. So she knew that we were always struggling with the idea of evidence-based, because most of the people think, that maybe Chinese medicine is just a by chance thing, it's, controlled stuff, but not really anything evidence-based. So this is what she's referring to. So I was just so glad to see that this poor cat has been struggling for almost 5 months and given all kind of different medications that we know of, in Western perspective, but did not work. Please don't take me wrong. I don't mean to point fingers in Western medicine. As I've said many, many times, Western medicine is outstanding when it comes to different diagnostics, tests, and emergencies, surgeries. So it has made even our life easier who practice Chinese medicine to see the diagnosis in front of us. So those things were all ruled out when CBC and ultrasound, everything was done. So it made it success of this approach much easier or better. So I think it has to be hand in hand, Western and the complementary therapies to make patient better. So here we go. So here is Tanuki and her famous normal feces after 5 months of struggling with chronic diarrhea. So she basically also wrote that this was 4th of July in Bessie's apartment. So at 4th of July, those of you my overseas friends may not know, this is our Independence Day in the United States on 4th of July. So we celebrate that by fireworks and people laugh and, be very happy. So she thought, just like having a 4th of July in Bessie's apartment. So I have given you these 2 references, which are very helpful, and I hope that those of you who want to learn more about what we did and how it happened. So Dr. Shea's red book is a one, and Dr. Memon also has mentioned diarrhea and the things that I just mentioned in our recently published book on integrative veterinary medicine. So with that, I'd like you to invite you on our next video, which is going to be about alpaca. Very interesting animal and very confusing and challenging case, which I intend to discuss with you on our next video. In the meantime, please like, share, and subscribe to this channel. I'll see you soon. Take care. Thank you.